Welcome! In this video, you will learn how to master heart echoes with HeartFocus. We will give you tips for when scanning using the live guidance feature. Let's start from the beginning. The first step to obtaining high-quality images is to ensure the setup is correct. Sometimes setting up correctly can be difficult, as you have to think about the patient's position, the probe orientation, and the imaging quality of the echo. First, you must ensure that the patient is in the correct position, depending on the view you want to acquire. For parasternal and apical views, the patient should be in the left lateral decubitus position, with the left arm extended behind the head. The patient's chest should be tilted slightly more away from you for the apical views. The goal is to open up the intercostal spaces to make imaging the heart from different angles easier. For subcostal views, the patient should be in a dorsal decubitus position, lying on the back with the knees bent. A comfortable patient position is essential to the success of the examination. Now that your patient is positioned properly, let's look at the probe orientation. The probe has a marker on its side, and its orientation is key. On the bottom right of the screen, an example of a patient's chest is displayed. This is here to help you determine the direction the probe marker should point. The marker must be on the side towards which the white arrow is pointing. In this example of apical four-chamber view, the marker should be oriented towards the ground. It is important to visualize the heart on the patient's chest before scanning to ensure you are orienting the probe in the right direction. Once you visualize the target area, try to browse the area by going back and forth methodically until finding a spot where the guidance is displayed. Then, let the software guide you. The good news is that getting one view means getting them all. Once you have found the right position for the window's starting view, parasternal long-axis view for parasternal, four-chamber for apical, and four-chamber for subcostal, the other views can be obtained by simply rotating or tilting the probe. In some cases, when the heart structures of interest are not visible, the live guidance is not displayed when acquiring a view. Here are some tips for you that may help. The ribs or gas may obstruct the image, preventing the live guidance from identifying the heart. When this happens, it is important to increase your search area by scanning over a larger portion of the chest until you find the right probe position and acoustic window. You must also be careful with your probe angulation and keep in mind that the probe should not be perpendicular to the skin. Angulation towards the heart is often needed to obtain the best image as you pass between the ribs. Patient position or breath can also help if the live guidance does not appear. Try to tilt the patient slightly, as this will shift the heart inside his chest and can help you to get a better image. For the parasternal and apical views, you can ask the patient to breathe deeply, as it helps to open the intercostal spaces and get a better image of the heart. For the subcostal ones, you can ask him to hold his breath for a few seconds while you reposition the probe. Sometimes the live guidance will display correctly, meaning that the oval aligns with the white cross, but the auto record feature is not triggered. This indicates that the image quality is not sufficient for diagnosis. If this happens, you can try to find another intercostal space. The image might be unclear because the current space between the ribs is obstructing the ultrasound waves. Try to move the probe up or down to a different intercostal space to capture a clearer image. Probe orientation also plays a major role. Keep always in mind that the ultrasound image should cross the heart inside the patient's chest. For the apical view especially, the probe should be tilted toward the heart and the right shoulder and not perpendicular to the skin. Another tip here is to return to a known view from which you can simply rotate or tilt the probe to obtain the desired views. For some patients, especially those with poor echogenicity, it might be difficult to obtain an auto record. In these cases, if you continue scanning for a while, the system will offer another type of recording called best effort record. Always click to save the best effort record if offered. It may not be perfect, but it's better than missing the image altogether. In this video, we have covered three main areas to get a good start with image acquisition with HeartFocus and master the guidance. What to do before starting image acquisition. What to do when live guidance is not displayed. What to do when live guidance is displayed, but recording is not triggered. By following these tips, you will be able to capture high-quality diagnostic images. Remember, even experienced sonographers encounter challenges. Simply practice, and you will soon see progress.